Good afternoon, everyone. We're just going to wait another minute as participants are coming into our webinar. Good afternoon, everyone. We're just going to give it another 30 seconds as we have participants still coming into our webinar. All right, we'll go ahead and get started. Well, good afternoon, everyone. My name is Connie Nakano, Communications Director for the California Department of Aging. Welcome to our all-stakeholder meeting this afternoon. Next slide, please. Just some logistics we'll go over. Participants are all muted during the presentations. You may use your raise hand icon during the Q&A portion to request your line to be unmuted. Closed captioning is available. Access it by clicking the icon at the bottom of your Zoom screen. We will have a Q&A session if time allows at the end, but please put your questions in the Q&A chat box and we'll try to answer it during this time before the Q&A session. Presentation recording will also be archived and you can visit the CDA's YouTube channel to access it. Next slide. We've got a pretty full agenda today, so we'll start off with hearing from our director. We'll be going over some major program initiatives. You'll hear about proposed legislative budget investments, some updates from our older adults program and health at home. Also hear from our long-term care ombudsman, update on master plan for aging, and also the COVID-19 vaccine and booster campaign. So now I'd like to turn it over to our director, Susan DeMorris.
Thank you, Connie, and hello to everybody who's joining us today. Right now, we've got about 75 participants, and thank you for making time to hear an update from the Department of Aging. I'm going to keep my comments quick because you saw the lineup that we have today, but I wanted to be sure that I started by thanking the CDA staff team. You're about to hear about a tremendous amount of work that's been happening the first half of this year as we approach the 18-month mark for our state's master plan for aging. And we prepare to end the state fiscal year at the end of June. So I want to thank our team. You'll see a slide. We all were able to gather for our staff picnic for the first time in person recently. About half of our staff have joined the department since the pandemic. So many of us were meeting each other for the very first time in person. It was a great day for CDA. I also want to thank everybody who's on the call for all that you did during the month of May for Older Americans Month and Older Californians Month, and for everyone who joined in honoring World Elder Abuse Awareness Day just last week. We were able to see lots of social media from our AAAs and our Independent Living Center and ADRC partners around the state. So thank you for raising awareness of older adults and older Californians during the month of May. June is a very busy month. Many of you know we're putting the final touches on the state budget, and you'll be hearing quite a bit about that later on the agenda. It is Pride Month and Alzheimer's and Brain Awareness Month. So we have webinars planned on both of those topics and are eager to share with you what's happening there. So today you all have my thanks and appreciation for all that you're doing, especially when it comes to the legislative and budget cycle. We're seeing your letters of support and your advocacy, and I know that many of you are working very, very hard right now to serve your clients and to advocate for the programs that are so important to all of us. So thank you for that work. And now I'm so happy to pass it on to Mark Beckley, our Chief Deputy Director at CDA, who will be updating you on our major program initiatives.
Great. Thank you so much, Susan. I'm happy to be here with all of you today. I'll be giving an overview of our major program initiatives. Next slide, please. Over the past 2 years, CDA has been fortunate to receive funding to enable us to launch 18 new initiatives to help us implement the Master Plan for Aging and other administration priorities that benefit older adults, individuals with disabilities, and family caregivers. Later in this presentation, our program deputy, Sutep Lahavanich, will be giving an overview of some of these initiatives. What I'd like to introduce you today is a new project tracker that we are in the process of creating. Next slide, please. So we've been working on a project tracker that will be made publicly available so that you can track with us all of the progress that we're making on each of our 18 initiatives. The layout of the tracker is the title of the initiative, a brief description, funding amount, funding source, expiration of funding levels, and then a quarterly overview of all the key milestones that we have achieved and that we will be achieving in upcoming quarters. So this spreadsheet will be available on our public website. We expect it to be available as soon as next week. And please visit this so you can see all the great progress that we're making in concert with all of our stakeholders and all of our partners on each one of these 18 initiatives. Thank you so much. And with that, I'll pass it over to Thomas Cameron, our Deputy Director for Administration, who will now go over proposed new legislative investments.
Thank you, Mark. Hello, everyone. Thomas Cameron, Deputy Director for Admin here at the Department of Aging. As Mark touched on, I'll be walking through brand new legislative investments that were recently released to the public as part of the legislature's proposed budget package from both houses. Next slide, please. Before we jump into the investments, I just wanted to note very quickly for everyone that all the investments referenced throughout this presentation are still proposed and may be subject to change based on final budget negotiations between the legislature and the administration. That said, I will jump right on in. The first one is the COVID-19 mitigation and resiliency grants to combat senior isolation. That is a $61.4 million general fund investment. It's a one-time investment intended to be spent over 3 years to provide grants to adult day health centers and adult day programs to address critical infrastructure and health and safety needs resulting from the COVID-19 pandemic. Next up, we have the $20 million general fund investment for the Alzheimer's and dementia-related caregiver pilot program. Again, this is a one-time investment to be spent over 5 years for a pilot program that would support expanded access to evidence-supported dementia caregiver education and support programs. The next investment is a $12.5 million general fund investment for an RN/community health worker pilot in low-income senior housing pilot projects. And again, this is another one-time investment to be spent over 5 years to establish a pilot program that provides grants to organizations that deliver services to residents in senior affordable housing sites. Next slide, please. The next proposal is another one-time investment of $5 million to fund expanded research activities around LTSS financing. The next investment is a $450,000 general fund investment, again, one time, to fund the Long-Term Care Facilities and Public Health Emergencies Working Group. These funds would be for activities associated with that working group as they develop recommendations regarding best practices for developing policies, including those such as visitation during a public health emergency. The next investment is a one-time $1 million general fund investment to fund the completion of the Cal Long-Term Care Compare.org website in order to expand access to free, reliable, trustworthy consumer information on provider performance in the LTSS arena, using various publicly available data sources that are both state and federal data sources as well. The last two are the $4.5 million general fund age-friendly communities investment. Again, it's a one-time investment to be spent over 3 years to provide grants to local jurisdictions to plan and develop age-friendly action plans. And lastly, there is a multi-year proposal to fund the modernization of the Older Californians Act. This is a combination of both one-time and ongoing investments to restore funding for a variety of programs and initiatives authorized under the Older Californians Act, and to help reestablish basic older adult program infrastructure funding. As you can see, the funding is proposed at various levels over the next 4 fiscal years, and I'll briefly run through those. We start with $118.6 million general fund one-time investment next fiscal year, which is 22-23. In fiscal year 23-24, it adjusts up to $143.8 million. Again, that's a one-time investment. Then it adjusts down to in fiscal year 24-25 to $79.6 million one time. And then it levels out to $35 million beginning in 24-25, and that is an ongoing investment here at the Department of Aging. Next slide, please. As you can see on the screen, a summary of the legislature's proposed version of their 2022-23 budget package can be found publicly by following the link referenced in the slide. You can also find the list of detailed actions that both houses of the legislature adopted on various items associated with the 2022-23 state budget as well. And then lastly, it's always a great reminder to see the wonderful investments from both the legislature and the administration in furthering the master plan for aging since we launched it. And we have a link there as well. That concludes my presentation. Happy to answer any questions in the chat. And beyond that, I will hand it over to Suta for the next section.
Thank you, Thomas. For these next couple of updates, I'd like to highlight new investments starting this new fiscal year and a lot of exciting investments and opportunities for innovation. Over $200 million of new investments starting this fiscal year. This is on top of our existing programs and services our AAA network and extended partners provide. So CalFresh Healthy Living, which supports education and affording healthy nutrition and building partnerships in the community. That is increasing sites across our aging network with increased budgets and with targeted service goals to reach veterans, immigrants, tribal organizations, and then to further expand those efforts on equity in California. We have coming up the Senior Nutrition Intergenerational Activities, which will be supporting activities that bring children, individuals of all ages, and older adults together, which could be cooking demonstrations, community gardening events, communal meals, to bring the intergenerational activities together. We also have our Senior Nutrition Infrastructure Grants, which will sustain and support the senior nutrition capabilities of the network with meal prep supplies, repair, and maintenance of the senior nutritional infrastructure across our state. We also have investments in falls prevention, which are assessments and home modifications to support independence of older adults to remain safely in their homes and community. And then we have family caregiver resources such as respite services, caregiver training, and supports, additional investments in that area as well. And then on to legal services, legal assistance, supports, and counseling for older adults. And then our digital divide initiatives for access and connections, bringing devices, connectivity, skills, and tools to increase digital access and equity for older adults and disabled adults across the state. So really exciting things coming through our network this new fiscal year. Next slide, please. And then I also like to provide some updates on key programs and pilots here at the department. This new fiscal year, we have increased to $10 million of ongoing support for our Aging and Disability Resource Connections, or ADRCs. So we are continuing to support our ADRCs to expand statewide, providing support and technical assistance. We are working with stakeholders to update our ADRC designation criteria to accurately reflect the vision and capabilities of our ADRC network that we are building. And we have more work and initiatives planned around the ADRCs this year as well. Next slide, please. Some new investments, additional pilots. We'll soon be able to announce the launch of our California Community Program for Alzheimer's Services and Support, which we call Cal Compass. The CDA will be funding grantees to build a modernized approach to dementia-capable services at licensed adult day programs and adult day healthcare centers. This initiative will pilot promising practices that promote comprehensive community-based dementia services that delay the need for institutional care and to seek and advance health equity. We plan for this grant opportunity to be posted June of this year, and hoping to have the pilot launched in the fall, early fall, and through December 2024. And just to know, we are hiring at the department Alzheimer's disease and related dementias program and policy lead for the department. And this role will also be leading this pilot. So more to come on this as well. And next slide, please. And then finally, I'd like to touch on one more key initiative coming up this fall is our adult family homes pilot. This will place older adults with cognitive impairments, such as dementia or TBI, in the homes of participating families. So to provide older adults with a safe, supporting family living environment, and then to serve as an alternative to institutional care. This pilot is in collaboration with our AAAs, our Department of Developmental Services, which are regional centers and family health agencies. And also noted here as a plug that CDA is recruiting for the health program manager too, which will be leading the pilot project. And that position is on Cal Careers, and it's closing next week. So if you know of any potential candidates, please encourage them to look that up. Those are my updates for a program that I want to highlight. I will hand next to Blanca Castro. Thank you.
Thank you, Sutep. I will be very quick with the slides. We have quite a bit of slides we just want to share with you. So next slide. First of all, I just want to remind everyone that we do have 35 statewide programs across California. With that, and it's important to keep this in mind. Next slide. What we wanted to share is that our most recent data with the National Ombudsman reporting system, I'm just going to share with you some important points. We're seeing a decrease in the number of skilled nursing facilities, but we're not necessarily seeing a decrease in the size. Next slide. The SNFs continue to have large facilities, and as of 2021, we're still at about 118,000 beds. Next slide. With residential care facilities, though, we're starting to see and have been, but significant increase in the number of facilities that are being licensed. Next slide. And with that, we're seeing an increase in the number of beds. So just to show that there is really a shift to try to be more in the community, and people are wanting that in a residential care facility. Next slide. All this to say is that we have seen an increase, slight increase in the number of additional long-term care beds, recognizing that people in SNFs do require more intensive care, and they have more acuity levels of care. Next slide. But we only have right now about a slight increase in the number of paid program staff, and this is statewide. So we currently have about 244 paid long-term care ombudsman staff, and that includes state staff. Next slide. But what we have seen, and this is pretty dramatic, and it does show you some of the areas we're going to be focused on in the next several months. We've seen a 40% decrease in the number of volunteers, many of the reasons or the main reason is because of the COVID pandemic. But it's also much more difficult right now to be able to recruit, train, and retain volunteers for the ombudsman program. Next. So while we saw a decrease during 2020, it was only because of the COVID-19 pandemic, but this is important. The last 5 years or since 2016, consistently, we probably have over 40,000 complaints in residential and long-term care facilities. Next slide. These are the top complaints from about residents, and they have not changed even in 2022. Next slide. So all this to say is that part of our goals are within the Department of Aging strategic plan. So advocacy is one of our top priorities to increase more staff in facilities, reform nursing homes, and I'm going to touch on a few of those things. But here are the 7 top areas that we're focusing on, not just this year, but for the next few years. Next slide. So with the advocacy at the federal and state level, we submitted comments yesterday. This is really just for information that we will certainly include that and try and post that on our website. But just important to note that the main purpose of the request for information was to address 2 questions. What are some barriers to people being able to access programs under the older that are funded by the Older Americans Act? And we focused only on the long-term care ombudsman program. And then what are the barriers to equity? So next thing that we're focusing on is there is a notice of proposed rulemaking. These are formalized comments, and there are 17 questions. We've been working with other states. We've been working with the Consumer Voice or our National Resource Center on developing responses for 17 questions that are really looking at what are mandatory staffing standards, what should they look like, what's evidence-based, and how are we going to enforce them across the nation. So it's not just for California, of course, that we're focusing on, but we're asking the Centers for Medicare and Medicaid to establish minimum standards, and on top of that, making sure that not only are they mandatory, but that there's an enforcement to them. So we will share those with everyone, and then I'll be sharing a link to how you can submit very easy stories about what it looks like when there aren't enough staff in facilities. Next slide. The other item that I just wanted to touch on is that when President Biden issued the proposal earlier this year on nursing home reform, and this is really an incredible opportunity. Here are all the initiatives that the federal government is looking at, whether it's at Health and Human Services or whether it will require legislation. And while California is addressing a lot of these areas, we still have a long ways to go. Next slide. And in California, last year was a pretty phenomenal year in terms of nursing home reform, but where the long-term care ombudsman and the 35 programs are really involved supporting are these 8 bills. And I won't go through each one of them because of the want to leave it opportunity for questions, but these are the 8 bills that we have we're standing in support of, and we are continuing to advocate. I would say the one that has the biggest pushback from the industry is AB 1502, which would require when there's a change of ownership for a skilled nursing facility that new owner needs to go through the same level of scrutiny that any new owner would have to go through before they acquire a new facility. Next slide. Some great news. In terms of increasing public awareness, we are really pleased to see that the that the governor has proposed in his May revise, and we will be receiving $3.5 million for the state long-term care ombudsman program. We'll be working with our communications partners at the Department of Aging. And all this is to hire a firm through a competitive bid to help us to develop a user-friendly website, materials, and a way for people to be able to be informed about how to access the long-term care ombudsman at the local level and how to report any complaints. A few other items that we wanted to touch on is this year we had an incredibly successful event. The Department of Social Services and Department of Aging combined forces with a number of different advocacy groups. If you did not attend it, it is available to see a brief snippet of the movie or the documentary, All the Lonely People. The documentarians, Stu Maddox and Joseph Applebaum, were in attendance, and we had over 250 attendees throughout this 2-hour event. It was just really focusing on the fact that isolation is something that does, not only has it been through COVID, but it's certainly a chronic problem, and it is part of elder abuse, and something that we need to address, and something that we can address through public policy and through many of the programs that we do offer under CDA. And then the last thing I will note is that through LGBTQ Awareness Month, or through Pride Month, we will be participating in a webinar and focusing on how within the long-term care ombudsman, how are we serving people who are in the LGBTQ population and their families, and how do we continue to improve the quality and the care of people who are LGBTQ plus in long-term care facilities, so that there isn't a fear and there isn't a need to go back in the closet. Next slide. A couple of more. We part of our quality and innovation initiatives. We are in the process of streamlining our monitoring process, and that would be for the local programs. We did an in-person training with all of the local long-term care ombudsmen. It was held here in Sacramento. And then we are in the process of launching a uniform core curriculum for all our long-term care ombudsmen. This will be certainly part of the overall Department of Aging's Academy of Learning Academy at a later time, but from this last quarter, this is what we've been focusing on. And the last thing is we're modernizing and streamlining our background clearance, certification, and decertification of long-term care ombudsmen. Next slide. And now I will turn it over to Amanda Lawrence on our master plan for aging.
Thanks, Blanca, and good afternoon, everyone. So I'm Amanda Lawrence. I'm the project director for California's Master Plan for Aging. For those who haven't been following the master plan, it is the governor's 10-year blueprint for government, philanthropy, private sector, and community-based organizations to build a state for people of all ages and abilities. And the plan is comprised of 5 bold goals, and they cover areas like housing and livable communities, health and healthcare, including home and community-based services, equity and inclusion, caregiving, and affording aging. So we're 1.5 years into the implementation of the master plan. We launched last January, and this January we released our first annual report, as seen on this slide, and it is still available on our website if you'd like to look at that. And we will provide further updates this coming January on progress of the master plan. Next slide, please. Just want to note that this is the 1-year anniversary of California joining AARP's network of age-friendly states and communities. We were the 8th state to join this network, So ahead of the curve, California is a national leader with our master plan for aging, and this is just another way that we can show our commitment to age-friendly statewide planning. Incredibly, we have over 70 local municipalities across California who have also joined this network. So cities and counties and states can join this network, and California has just so much buy-in and so much engagement with AARP. If you are in a community that hasn't joined one yet, I just want to give a little pitch for that, because AARP provides wonderful technical assistance and guidance through local age-friendly planning. Next slide, please. An additional resource, though, is the California's Master Plan for Aging's local playbook. We developed this to provide local planning and guidance for counties and cities who want to implement their own master plans for aging, and it is available on our website. Over the past quarter, we have had 3 rural communities launch a formal master plan for aging process. It is in partnership with the SCAN Foundation. Those counties are Butte, Shasta, and Glenn. And then we have Kings and Tulare, and then Riverside and San Bernardino. They are each, they've come together to do some age-friendly planning. It's fantastic, and will share their lessons learned and additional rural age-friendly planning resources with us throughout their process. It will culminate in a master plan for aging in 2 years. Next slide, please. So I want to point out some ways that folks can be engaged with the master plan for aging. We have 6 stakeholder advisory committees. Each of them meet publicly. So there's an opportunity for public comment at each of these meetings. Actually, this Thursday, the Alzheimer's Disease and Related Disorders Advisory Committee meets. They'll be talking about dementia standards of care and the Healthy Brain Initiative, among other things. And so this committee really provides ongoing advice and assistance on program needs and priorities of persons impacted by Alzheimer's disease and related dementia disorders. California Aging and Disability Research Partnership will meet in July. I'll talk a little bit more about that in a couple minutes. The California Elder and Disability Justice Coordinating Council continues to meet. Their 3rd meeting will also be in July. And some progress made to date with this council is that they have created an equity framework to guide this council's work in ensuring that the work that they do, the recommendations that they make, are really dismantling injustices and promoting equity in aging and disability. Next slide, please. Disability and Aging Community Living Advisory Committee, it's a mouthful, continues to meet, and they have developed 2 subcommittees that have been very active. There's a housing subcommittee and a transportation subcommittee. And membership to these is, you don't have to be on this particular committee to be on a subcommittee. So if you're interested, join us at our next meeting, and we can get you connected with folks who are leading these 2 efforts. But the transportation subcommittee meetings are going to be meeting monthly, and they'll be public. And so we'll post those on CDA's website as soon as we have all that information available. Additionally, meeting this month is Equity and Aging Advisory Committee. They meet quarterly as well, and they really advise on the implementation of the master plan, as well as on CDA's programs and hiring practices. And Impact Stakeholder Committee. This is the primary body of oversight over the master plan for aging. They've continued to meet throughout this past quarter and will meet again in July. They did release a report that is available on CalHH's committee webpage on their thoughts on the first year of implementation. And we'll be sure to get all of the links to each of these committees pages up in the chat box in a moment. It's quite a bit. I wanted to go back. So next slide, please. I want to talk a little bit about the California Aging and Disability Research Partnership. We're particularly excited about this. It was called for in the master plan to create a nation-leading research partnership between the state and California's universities. So in partnership with the Center for Data Insights and Innovation, we established this partnership. It's comprised of experts in aging and disability research from leading academic institutions, state government, as well as some philanthropic organizations. And their primary purpose is to advance age-friendly and age and disability-focused research to strengthen the evidence base for promoting equitable opportunities for Californians to thrive as they age. They also provide input on key performance indicators and data sources to inform the Master Plan for Aging's outcome reports, as well as our data dashboard for aging. And they're also just a model research partnership between state government and academic institutions. Really, I think the first of its kind to focus on data that's really for action and equity, focused on aging and disability populations. It's good and really focused on the person-centeredness and data-driven priorities. Next slide, please. So we had 3 webinar Wednesdays this past quarter. Well, actually, we've had 2 so far. We have one coming up tomorrow, in fact. Tomorrow we have an Alzheimer's and dementia focused webinar scheduled at 10 a.m. and it will focus on the challenges, opportunities, and equity in Alzheimer's and dementia care and service delivery. We have a fantastic panel set up with experts in equity and Alzheimer's, dementia. We have someone speaking who has lived experience with a brain disorder and also serves as who is personally is a caregiver as well. So want to have the perspective of everyone, the true person-centered perspective showcased in each of our webinars. This is our final webinar Wednesday, but we have a bonus webinar scheduled on the 14th. Next slide, please. This webinar will cover our direct care workforce initiative, which is called California Grows, growing a resilient, outstanding workforce in home and community. So CDA is launching a direct care workforce training and stipends program, and it's going to incentivize, support, and fund career pathways for folks who are in the non-in-home supportive services direct care workforce. These are people who work in settings such as community-based adult services, the multi-purpose senior services program, and the program for all-inclusive care for the elderly, among others. And it really seeks to provide a foundation for many of the positive outcomes in home and community-based services. This includes increased skills, satisfaction, retention, career development opportunities. And so during this webinar, we'll provide an overview of the workforce initiative, its timeline for implementation, and there will be time for Q&A. So we can post the registration link in the chat in a moment for that as well. Again, that's on the 14th at 4 p.m. My final slide, next slide. I wanted to throw a save the date out there. On September 20th, the Master Plan for Aging is hosting a California for All Ages and Abilities Day of Action. This is modeled after the White House Convention Convening on Aging. I said that wrong, and we will basically bring together stakeholders from across all of our different committees. They will each present their platform, their top priorities for the next 2 years of the Master Plan for Aging. We will open up registration to the public, and we'd love to hear from everyone about their top priorities for the next year or 2 of the Master Plan. If you haven't seen the Master Plan, it has 2 years of initiatives for 21-22. We're wrapping those up, and now we need to come up with another 2 years worth of initiatives for the government to commit to and hold ourselves accountable to over 2023 and 2024. So this will be in Sacramento. It's an in-person event. It will not be hybrid. There is potential for maybe some streaming of a couple of the different sessions, but we will open up registration in the next couple weeks. So just keep your eyes out for that. I'm going to go ahead and pass it on to Connie, who's going to talk about COVID-19 vaccine outreach.
Thanks, Amanda. Good afternoon, everyone. Connie Nakano again, Communications Director for Department of Aging. Next slide. So just to give you guys a little summary or update about our COVID-19 vaccine and booster outreach. So CDPH data indicates there's 92% of 65 plus have had 1 dose or more of the COVID vaccination. However, only 57% have completed their booster series. So you can see that there is still a need to encourage older adults to stay updated with their vaccinations. Our statewide vaccine outreach continues with paid and earned media tactics, including broadcast radio, television, online, and direct mail in English and other languages. Next slide. Here's a little snapshot of some of the items that we've utilized, and also you can hear some little samples of our TV and radio spots, and also get a sneak peek of our direct mail pieces. Next slide. We're also excited that we will be distributing an 8-page newspaper insert at the end of June, which will be a one-stop resource guide for older adult resources and also information for the COVID-19 vaccine and boosters. So that will be inserted into a lot of the major dailies statewide by the end of June. Next slide. And also, we still have vaccine outreach campaign resources available. We do have printed direct mail pieces for you to send out or pass out if you'd like. We have a direct link here in the PowerPoint, and we'll also drop it in the chat as well. If you'd like to order any of these pieces, they're free of charge. They're already printed. They will just get mailed directly to you, and you can distribute them or mail them as it fits your outreach needs. Next slide. And again, a lot of the information on what we're doing for the COVID vaccine outreach campaign can be found on our CDA webpage under the highlight section, and a direct link will be dropped in the chat as well. So now I think we can move into our Q&A portion. Back one slide, not done yet. We have our Q&A portion that we're moving into. So if you'd like to ask a question, you can use the Q&A icon at the bottom of your screen and type in your question, and we can read your question live. Or if you'd like to ask your question live, go to your raise hand icon also at the bottom of your screen, and we will unmute your mics so that you can ask your question. So while we're waiting for questions to come in, let's go to our poll question. Nelson, if we can bring that up. We just had a poll question. We were kind of curious. We wanted to know the information shared during our stakeholder meetings, if you find these helpful. So we just kind of like to get a gauge on if you find these meetings helpful or not. We're always continually trying to improve the information that we are putting out to all of you, our stakeholders. We'll also be sending out a survey shortly that'll have a few additional questions in terms of the types of topic or the types of information that you would like to hear or see, whether it's in the stakeholder meeting or also our newsletter. So I'll give it another maybe 30 seconds for the poll questions. It looks like we've got some folks answering. So thank you for those that have taken some time to answer the poll. It looks like, let's see, I'll end the poll here and we can share the results. So thank you everyone that answered our poll question. It looks like we've got strongly agree that the information shared during the stakeholder meetings have been helpful. So thank you very much for that feedback. All right, let's move over to our Q&A questions. Let's see, do we have anyone live? I don't see anyone that has raised their hand. We will go over to our Q&A box. So we have a question here, and I see Mark is typing an answer to it. I'm wondering, Mark, if you'd like to address it live, possibly. It's a question about providing more details about grants for local age-friendly action plans, or is it too soon to elaborate? So if there's a little more information on that.
Right, yeah, happy to answer that one live. That is a legislative proposal, so we are waiting to see if there will be trailer bill language that accompanies that will provide more information about how the grants are to be distributed and how they're to be used. So as soon as we get additional information, we'll definitely share that out. I can also tackle the next question, which is the project tracking sheet. And absolutely, yes, that will be shared on our public website. As soon as it becomes available, we will send out the link to stakeholders through our Facebook, Twitter accounts, as well as probably doing email blasts as well to let people know what the link is.
Great, thank you for answering those questions, Mark. Next question we have, do you have any updates on the Dignity at Home contracts and when we should expect those? Would that be Sutep?
Yes, I can answer that. The dignity at home contracts is the falls prevention contract. So we are looking to get those out, anticipating by the end of the week. With that includes our senior nutrition, intergenerational activities, our legal services, and as well as our family caregiver support. So those will be anticipated to go out.
Great, thank you, Sutep. Let's see. So another reminder, again, or if you'd like to ask a question live, feel free to click on the raise your hand icon at the bottom of your screen and we'll unmute your microphone so that you can ask your question live, or feel free to enter your question into the chat box. So I'll give it another minute for additional questions to come in. We have one question here. Will there be updated guidance regarding the MDD and OAA service delivery and how long that those flexibilities will continue? Would that be Mark or Sutep would be able to answer that?
Yes, I'll take that right now. And we are looking at, right now we are in the MDD, but we are looking at, how do we prepare ourselves for that when the MDD expires, and how do we unwind? So we are looking into policies and guidance coming out of CDA in terms of when that MDD will end at some point. So we need to all be prepared and supporting our AAA networks to be able to do that. So.
And then there's a question for, I think, Amanda, when will the research group meet again? Do we have a date for that?
It is July 20th, I believe, but let me just double check.
And we can confirm that date and also drop the link in the chat as well to the registration.
It's July 15th. The link is already in the chat.
Okay, perfect. Okay, let me see if there are any hands raised. And again, if anyone has any questions about any of the materials presented today, please feel free to enter it into the chat or raise your hand. I don't see any hands raised. And then, let's see. Just do one more minute for any additional questions. And just a reminder, if you've missed anything in today's meeting, this meeting is recorded, so it will be uploaded onto CDA's web channel when it's available, and also the PowerPoint for today will also be made available as well. We have one more question that came in, status about the no wrong door. I believe that's kind of around the ADRCs. Sutep, do you want to take that?
Yes, certainly. Yes, our no wrong door effort is aligned with our ADRC expansion efforts across the state. So that work continues within the ADRC, but also connects to our MPA work, and then a lot of the stakeholder work around no wrong door and ADRC is with our ADRC advisory committee that occurs bi-monthly. So that continues to be a work in progress across the department and across our sister agencies in terms of building that network across the state.
Great, thank you, Sutep. I think we've addressed all the questions. There is one question here, I think in the chat, that's not exactly on some of the content that we proposed, but it's more of a comment. Broadband and cellular companies are heavily contributing to political campaigns that are not pro older adult. As we expand broadband and cellular access, reliability, and affordability, how can I ensure I'm not contributing to efforts detrimental to my interests? So to answer that question, is there, it's not exactly pertaining to any of the information that was presented today, but I'm wondering if there's a referral, and I'm going to tap you, Amanda. Is there something regarding like telecommunications and MPA that this individual might be able to participate in and express their concerns or opinions?
We do not have a committee related to broadband or cellular companies.
Okay, we'll follow up with you, Leslie, offline, but thank you for your question. And I don't see any additional questions and hands raised.
Connie, this is Mark. I did see in the chat that there is a question about hospice referrals. And, you know, what I can say about that is we are in the process of bringing on board health policy staff in the upcoming year. That's certainly mentioned in the Master Plan of Aging, and that's definitely something that we'd be looking at. And of course, that would be done in collaboration with CDPH and with DHCS as well.
Great, thank you for catching that question in the chat, Mark. Okay, so it doesn't look like there's any additional questions coming through raising your hand or in the Q&A. So what we'll do is, I think we will wrap today's all-stakeholder meeting. So thank you everyone for attending. Again, today's presentation and also the recording will be available on CDA's website. Thank you again, and we hope you all have a good afternoon.